Parasite cleanses exposed. Do we all have hidden worms or risky hype? Sounds dramatic, and that is why we are here to separate signal from noise. In this video, we will follow the facts from how common parasites really are, to which symptoms matter, to tests that work, to treatments that cure, and to myths that mislead. We will also look at safety issues around popular cleanse products and end with a simple prevention playbook you can start today. Stay for the bonus at the end. This video is educational only and not medical advice. Let us begin by asking the most viral question. Is the average person truly walking around with hidden worms? The short answer is no for most people in high-income countries, and that is not my opinion. The Centers for Disease Control and Prevention reports that the average healthy person in these settings does not carry active intestinal parasites. The bigger picture, however, is global, and the World Health Organization shows that parasitic infections concentrate where sanitation and clean water access are limited, especially in tropical regions. Risk is not uniform. As guidance from the Infectious Diseases Society of America explains, exposure matters. Think recent international travel, camping with untreated surface water, crowded daycare settings, or weakened immunity. With that map in mind, let us contrast worldwide burden with local realities so the numbers make sense. Worldwide figures can sound scary until we put them in context. The World Health Organization estimates that soil-transmitted worms affect roughly 1.5 billion people, mainly in resource-limited regions where open defecation and poor sanitation persist. In contrast, a paper published in the Journal of Clinical Nutrition describes Giardia rates of about 2 to 5% in high-income nations and much higher in endemic areas where water is not reliably treated. Even in wealthy countries, clusters still happen when sanitation fails, as the Centers for Disease Control and Prevention notes in its outbreak reports. If this evidence-first approach helps you cut through hype, consider subscribing so you do not miss future myth-busting guides built on peer-reviewed sources. Now that scale is clear, it helps to meet the organisms behind the headlines. Among the microscopic parasites, 3 names show up again and again: Giardia, Entamoeba histolytica, and Cryptosporidium. The Centers for Disease Control and Prevention explains that these protozoa often cause watery or greasy stools, gas, and bloating after contaminated water, food, or close person-to-person exposure. The World Health Organization emphasizes that improved drinking water and hygiene sharply reduce these infections, which is why risk jumps with backcountry travel or poor sanitation. Diagnostic technology has evolved. A review in the Cochrane Library finds that stool antigen tests and molecular panels can outperform basic microscopy, especially when shedding is intermittent. Knowing the small actors sets us up to recognize the larger ones. Intestinal worms, helminths, are the visible side of the story, yet they are not a single thing. The World Health Organization identifies Ascaris, roundworm, trichuris whipworm, and hookworm as classic soil-transmitted infections that thrive where human waste contaminates soil. The Centers for Disease Control and Prevention list tapeworms such as Taenia and dwarf tapeworm Hymenalepis as additional intestinal culprits, often linked to undercooked meat or poor food handling. The American Society of Tropical Medicine and Hygiene warns that Strongyloides can quietly persist for decades and, under steroids or immune suppression, trigger dangerous autoinfection. Understanding which parasite fits which risk is the key to understanding which symptoms should get your attention. Certain patterns raise suspicion fast. According to the Centers for Disease Control and Prevention, persistent watery or especially greasy stools with bloating and weight loss point toward Giardia and related protozoa. PLOS Neglected Tropical Diseases describes hookworms' slow blood loss, leading to iron deficiency anemia, fatigue, and reduced exercise capacity and heavy burdens. For children who cannot stop scratching at night, the American Academy of Pediatrics notes that perianal itching after bedtime strongly suggests pinworm. When symptoms match exposure, say prolonged diarrhea after river water on a camping trip, that is when testing becomes not just reasonable but useful. To avoid false alarms, it also helps to know which common complaints usually come from non-parasitic causes. Many people attribute bloating or vague cramps to worms, yet specialists caution otherwise. The American College of Gastroenterology explains that irritable bowel syndrome is far more common and is driven by gut sensitivity, stress, and diet. The British Medical Journal details how lactose intolerance and FODMAP sensitivity frequently cause gas and diarrhea that improve with dietary changes. The New England Journal of Medicine describes how reflux, poor sleep, and functional dyspepsia can mimic infection without any organism involved. When symptoms are nonspecific and exposures are absent, the odds favor non-parasitic explanations, and that is where a careful history and targeted testing, not guesswork, pay off. Testing is not for every upset stomach, it is for the right story. The Centers for Disease Control and Prevention recommends testing if symptoms persist beyond a brief bug, and there is realistic exposure, such as recent travel to endemic areas or drinking untreated water. Both the World Health Organization and the Centers for Disease Control and Prevention advise evaluation during daycare clusters or when multiple household members fall ill. The Infectious Diseases Society of America urges urgent care if there is fever, blood and stool, significant weight loss, severe abdominal pain, or dehydration. When those criteria are met, your clinician chooses the tests that fit the likely organisms and the timing of illness. Microscopy still matters, and it has rules. The Centers for Disease Control and Prevention explains that stool O and P, ova, and parasite works better when you submit 3 samples on different days because eggs and cysts shed intermittently. Reviews in the Cochrane Library describe laboratory concentration methods that increase the chance of catching small numbers of parasites in each specimen. The Centers for Disease Control and Prevention also cautions that a single negative result does not end the conversation when suspicion stays high. Repeating specimens or adding more sensitive tests can be appropriate. Patience and proper collection technique improve accuracy and avoid unnecessary treatment. Modern assays close many gaps. The Cochrane Library reports that stool antigen tests and multiplex PCR panels raise sensitivity for Giardia, Cryptosporidium, and Entamoeba histolytica compared with routine microscopy, which is especially useful when symptoms continue but eggs are not obvious. The Centers for Disease Control and Prevention reminds us that pinworm does not show up well in stool. The morning tape test at the anus, before bathing, captures eggs best. The American Society of Tropical Medicine and Hygiene notes that Strongyloides can evade stool exams and may require blood serology, particularly when steroids or immunosuppressants are in the plan. With a clear diagnosis, we can finally talk about what actually works. Over-the-counter parasite cleanses sound appealing, but the evidence is not there. Systematic reviews in the Cochrane Library do not find high-quality trials demonstrating that multi-herb cleanse products eradicate lab-confirmed infections. The Centers for Disease Control and Prevention cautions that dramatic testimonials without diagnostic confirmation do not prove cure and can delay real care. In contrast, clinical guidance from the World Health Organization and the Infectious Diseases Society of America shows strong cure rates when standard antiparasitic medications are used correctly for identified organisms. When decisions are guided by testing and targeted drugs, people tend to get better faster and safer than with general cleanses. So why do some people feel better during a cleanse? A paper published in the Journal of Clinical Nutrition points out that cleaning up diet, less ultra-processed food, more fiber, better sleep, often improves gut comfort on its own. The Centers for Disease Control and Prevention explains that laxatives and fiber gels can produce striking stool shapes that people misinterpret as parasites. The American College of Gastroenterology adds that many digestive symptoms resolve naturally over days to weeks, which can look like a supplement success story. If careful, referenced breakdowns like this help you navigate health claims, consider subscribing so we can keep producing long-form, evidence-based guides. With myths swirling online, let us check the most persistent ones. 3 ideas dominate comment sections: die-off reactions, biofilm ropes, and the claim that everyone has worms. Guidelines from the Infectious Diseases Society of America make clear that feeling temporarily unwell during treatment does not prove toxin die-off. It can reflect side effects or the illness itself. Trends in Parasitology examines so-called ropeworms and concludes they are mucus aggregates, fiber casts, or sloughed intestinal lining rather than living organisms. Both the Centers for Disease Control and Prevention and the World Health Organization show that universal worm carriage is not a reality in high-income settings. Naming these myths is not about shaming. It is about protecting you from wasted time, money, and risk. Those unsettling, stringy stools deserve a straight explanation. The American College of Gastroenterology notes that mucus strands can appear with irritable bowel and minor inflammation and often look like threads. Trends in parasitology documents that psyllium and activated charcoal can gel into rope-like structures that resemble worms but are just hydrated fibers. The Centers for Disease Control and Prevention emphasizes that true worms have structure, segments, identifiable anatomy, or movement, and require laboratory confirmation. When in doubt, photograph what you see, avoid self-diagnosis, and ask a clinician whether stool testing or the tape test is appropriate. Real infections are treatable with proven medicines. The World Health Organization and the Infectious Diseases Society of America recommend albendazole or mebendazole for roundworm, hookworm, and whipworm, often with high cure rates when dosing is correct and reinfection risk is addressed. The World Health Organization lists praziquantel as first line for tapeworms and advises checking for cysticercosis risk if pork tapeworm is suspected. The Centers for Disease Control and Prevention supports metronidazole or tinidazole for giardiasis and amoebiasis and nitazoxanide for cryptosporiosis in selected cases, particularly in immunocompetent hosts. Short, targeted courses beat month-long cleanse regimens because they are matched to the organism and supported by trials. Certain scenarios require extra care. The Centers for Disease Control and Prevention advises treating all household members for pinworm and repeating the dose in 2 weeks to catch newly hatched eggs and stop reinfection. The World Health Organization recommends careful drug choices in pregnancy since some antiparasitics are avoided in the first trimester. Clinicians often use safer alternatives or time treatment appropriately. The American Society of Tropical Medicine and Hygiene warns that people on steroids or other immunosuppressants may harbor strongyloides that can spread dangerously, so providers sometimes test or treat preemptively. Safety is not a slogan here. It is a plan matched to your life and risks. Natural does not guarantee safe. StatPearls discusses wormwood and its thujone content, which at high doses has been linked to seizures and neurotoxicity. The Journal of Clinical Gastroenterology reports cases of liver injury with certain herbal mixtures, including products that list black walnut, and reminds readers that supplement purity is inconsistent. The New England Journal of Medicine reviews essential oils such as clove oil, causing mucosal burns and interacting with blood thinners and diabetes medications. Without regulation and diagnostic targeting, cleanses can add harm while postponing correct care. The better path is evidence-based testing, precise therapy, and prevention that reduces exposure in the first place. Pets are family, but they are not a reason to deworm humans on a schedule. The Centers for Disease Control and Prevention explains that pet Giardia and human Giardia are often different types, and transmission from pets to owners is uncommon with normal hygiene. The Centers for Disease Control and Prevention also warns about soil eggs from Toxocara and beach-acquired skin hookworm, which are best prevented by shoes, sandbox covers, and prompt waste removal. The World Health Organization supports routine veterinary deworming for dogs and cats. What protects humans is hand washing, yard cleanup, and keeping pets healthy, not self-prescribing human antiparasitics. Here is the promised prevention playbook you can actually use. The Centers for Disease Control and Prevention. Yellow Book recommends safe water practices on trips, boil, filter, or choose sealed bottles and skip questionable ice. The World Health Organization urges washing or peeling produce and fully cooking pork, fish, and street foods to cut the risk of tapeworms and protozoa. The World Health Organization also advises avoiding freshwater swimming in regions with schistosomiasis and wearing footwear outdoors in areas with hookworm. Daily habits like hand washing before meals, trimming nails, and teaching kids not to touch their faces while eating deliver quiet protection that cleanses cannot match. The take-home message is empowering. According to the Centers for Disease Control and Prevention, the Infectious Diseases Society of America, and the World Health Organization, Over-the-counter parasite cleanses are not proven therapies, while testing and targeted medications are reliable, short, and effective. As the Cochrane Library reminds us, matching the test to the exposure and repeating or expanding. When suspicion remains high, leads to clearer answers and better outcomes. Prevention beats detox every time. Clean water and food, simple hygiene, vet care for pets, and footwear where soils are risky. This is educational only and not medical advice. Please consult a clinician for your specific situation. If you want more calm, evidence-based investigations that respect your time and intelligence, subscribe and share this with someone who needs clarity today. And tell us in the comments which health claim you want us to unpack next.